Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Thursday, February 25th. We are joined today by the Minister of Economic Development, the Honourable Ranj Pillai, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Once again, our sign language interpretation is provided by Mary Thiessen and our French language translation by André Boursier from French Language Services Directorate. Following our speakers, we will go to the phone lines from reporters. We will call you by name, and you will each have 2 questions. Before we begin, I would like to verify that everyone can hear us. If any of the reporters are having a problem, please email ecoinfo@yukon.ca. Minister Pillai.
Great. So good morning. Thank you for joining us today. It's great to be here with Dr. Hanley on the traditional territory of the Kwalin First Nation and the Tawanquachin Council. It's great to see our active case count down to 0 again. I want to thank all Yukoners for your continued efforts to practice Safe 6+1. The +1, of course, is masking up in public. We laid another charge this past week under the Civil Emergency Measures Act for failure to wear a mask. And I really appreciate all of the people that are doing their part by wearing masks. This is a small but important step you can take to protect yourself and those in your community. The public health measures that are in place are important as we continue to roll out vaccines across the territory. As of yesterday, 10,865 Yukoners have received their first shot and 4,309 have received their second shot. The mobile teams continue to return to communities to provide the second shot. And I know they are in Beaver Creek today. The vaccine rollout is critical as we look towards spring. It's been great to see so much interest in the general clinic that will open next week in Whitehorse. I know there have been some issues with the booking system. There's a team working hard to keep it functional and accommodate the high demand. And I know we've seen this across the country, this push and for folks to sign up online. We appreciate everyone's patience over the past couple of weeks. While we have all experienced social and economic disruptions, the impact of the pandemic is also revealing our adaptability, perseverance, and resilience. And Yukoners have rallied around the business community by choosing to buy local. Businesses themselves have come up with innovative solutions to keep their doors open, and they continue to explore options and adapt to the pandemic. This month, the Yukon Chamber of Commerce launched a free shipping program for products that are created in the Yukon. The program covers the cost of shipping up to $100 to anywhere in Canada. This is a great way to share Yukon-made products with friends and family outside. So thank you to all local businesses contributing to our communities and to Yukoners who are supporting our local businesses and organizations in these times of strain due to COVID-19. In the initial phase of the pandemic, our government took bold action early to provide financial support to Yukon businesses and workers. We were one of the first governments in Canada to launch programs to support individuals and businesses impacted by COVID-19. Our response was a model for other Canadian jurisdictions. These supports included the Temporary Support for Cancelled Events Program and the Yukon Business Relief Program. These programs help businesses cover their costs and survive the initial phase of the pandemic. We also launched the Paid Sick Leave Rebate Program to keep workers and workplaces safe. Both of the Yukon Business Relief Program and the Paid Sick Leave Rebate are proving to be highly effective in supporting local businesses and workers. From April 2020 to February 2021, the Yukon Business Relief Program has provided more than $6.5 million to 488 businesses, while the Paid Sick Leave Rebate has provided more than $500,000 to 128 businesses in order to support 345 workers. We have allocated more than $44.8 million in supports to Yukoners to date. As the pandemic changes, so too must our response. We are monitoring economic indicators, adapting and responding as needed to continue supporting our economy. Today, I'm pleased to announce the expansion and extension of a number of key economic programs aimed at providing services to those workers and businesses who need them the most. We are renewing the paid sick leave rebate program until September 30th, 2021. This means that if you use the program and maxed out, you will be able to reapply as of April 1st. The Yukon Business Relief Program has also been renewed until September 30th, 2021, as it is continuing to help businesses cover fixed costs and remain operating. Businesses that have used the program and maxed out will be able to reapply as of April 1st. A number of supports will also continue through our $15 million three-year tourism relief and recovery plan. And I want to thank Minister McLean for her leadership on this and bringing it back to the cabinet table. So, under the tourism relief and recovery plan, an extension of the $4 million tourism accommodation and non-accommodation sector supplements will be extended until September 20th, 2021. A $450,000 contribution to Yukon's Elevate program, which provides tourism businesses mentorship, training, and funding for implementing recovery. And I know that the department has had, and Taya, working with them, has had a overwhelming response, and I know they've actually extended out the cohort of companies going through that right now. As well, a $300,000 enhancement to the Tourism Cooperative Marketing Fund, bringing the total of that program now to $1 million. I also want to remind culture and tourism nonprofit organizations who have suffered revenue losses that they can still apply for the culture and tourism nonprofit sector supplement for relief. Eligible Yukon restaurants and other businesses with a liquor license who are most in need will continue to receive a 25% discount on retail price of liquor until September 30th, 2021. We continue to work closely with the Canadian Northern Economic Development Agency to ensure businesses have flexible supports that reflect local needs and evolving economic circumstances. And I want to just thank the folks at the Northern Economic Development Agency. They've just been absolutely splendid to work with, and unprecedented collaboration between our departments, and I want to thank their leadership for all their work, tireless work. Together, we are offering a new loan program as well for businesses called the Regional Relief Loan Program to cover costs that help businesses stabilize and adapt. This program also offers preferential terms, including deferred interest and partial forgiveness. Each business can receive up to a maximum of $100,000 in loan. These loans will be interest-free until December 31st, 2022, and principal payments will be deferred until then. If an applicant repays 75% of the principal amount off the loan by December 31st, 2022, the balance, equal to 25% of the loan, will be forgiven. Applications will be accepted until March 31st, 2021. I want to thank the staff of Economic Development for their work to roll these programs out and provide support to Yukon businesses, and the team at Tourism and Culture for all their work and rolling out their programs. I also had the opportunity to check in with representatives from the Business Advisory Council yesterday, the day before yesterday, to talk to them about how we can continue to adapt and provide the necessary support for local businesses. I know that the business community is looking for increased opportunities in the coming months. Officials across government, including Dr. Hanley's team, are working on next steps as the vaccine rollout continues. We are putting resources in place for when we are in a position to adjust restrictions. Just last week, we approved an alternative self-isolation plan for the Klondike Plaster Miners Association and its members. This will allow Canadian plaster miners to self-isolate in Dawson City for 14 days in accordance with a number of guidelines that have been endorsed by Dr. Hanley and his team. And I want to thank the folks at the KPMA for all their work and collaboration with our officials here at the Yukon government. We will be working with folks in Dawson City to ensure they are aware of the guidelines and how they apply for minors that will be returning this summer. Last year, we worked directly with the 3 operating mines in the territory to approve alternative self-isolation plans for workers to isolate at mine sites rather than Whitehorse. And it is important to remember that these plans still require individuals to self-isolate for 14 days when they enter the territory. And it just provides the flexibility for where the isolation happens. Again, I want to commend those 3 operating mines for their good work and 0 case counts as well. These plans are reviewed and endorsed again by the Chief Medical Officer and then passed on to the Minister of Community Services. We're also working on plans to accommodate companies involved in the mineral exploration this summer, which is poised to have a busy year. And I want to thank Dr. Hanley and his team, along with the folks at the Community Services who work on all of these plans. These plans are helping support businesses in various industries across the territory to keep projects moving forward and to keep people working. The Department of Energy, Mines and Resources began to meet with exploration companies in November of this year and one-on-one bilaterally to understand what their needs were, what their budgets looked like, how many people were coming in. So we've been working on this, understanding that we are poised for a very busy, significant exploration season. And I want to thank folks on Dr. Hanley's team and at Energy Mines Resources. I know there was a very significant meeting this week, and we're working to make sure that we have the most efficient and safest ways to get folks out into the field and support our economy and the industry. As we look towards spring, the best thing Yukoners can do to help our territory move forward on our path is to take their shot, get immunized, and continue to practice the safe 6+1. Everyone who wants to get immunized will have an opportunity in the coming weeks, and I encourage all Yukoners to take their shot when it's their turn. We have made it through an incredibly challenging year, and together we can get to a better place this year. Keep up the good work, and thank you.
Thank you, Minister Pillai. Dr. Hanley?
Thank you, Pat. Thank you, Minister Pillai. Bonjour tout le monde. Good morning, everyone. I appreciate all of Minister Pillai's comments, and I think they show how, for one thing, they show how much background work, detailed, focused background work is being done within our shop and within government and with these various organizations and agencies that Mr. Pillai mentioned, in order to both mitigate risk but promote the ability to work and continue operating. And I think this shows how you cannot have a containment strategy that is successful without economic relief for businesses and individuals and supports, focused supports for those affected. And I think it shows how closely a healthy economy and a healthy society are intertwined. Our most recent cases have officially recovered, and I'm happy to confirm that once again, we have no known active cases within the territory. And glad as we are that these individuals did well and that we saw no further cases arising, I hope we all benefited from the reminder that I think we all needed. As we wait for the majority of our population to receive vaccination, it is up to us to make sure COVID doesn't get the chance to make that appearance in our lives. I can assure you that whether variant or run-of-the-mill COVID, it is standing by, ready to enter our lives. Each day that we commit to taking the necessary precautions, we get one step closer to where we need to be. It is crucial that we all continue to follow the Safe 6+1 and seek testing if you experience any symptoms. By taking these steps, we continue to protect ourselves and our community to the best of our ability. We continue onwards with our journey of vaccinating Yukoners. Team Balto and Togo are in Watson Lake and Beaver Creek this week, administering first and second doses to community members. And Team Fox is here in Whitehorse. When these teams return to your community, they are not just there to give second doses. You can also receive your first dose. And as soon as you get that first dose, you are guaranteed a second dose. The vaccine team is currently working out how to make that happen, that second dose visit happen for each community. And the way that this happens will differ from community to community. And a reminder for people who are still awaiting their second dose booking, if you have been unable to book through the online portal, please be patient. More appointment slots will be opening up, and you will be able to receive your second dose in time. Last week, we opened up booking for vaccinations to the general public after a few hiccups, and we have seen an incredible uptake in appointments. This is an exciting time, and the turnout so far shows so much promise that we are well on our way to immunizing a majority of our population. I'm looking forward to receiving my vaccine next week, along with my colleague, Dr. Elliott. And since we announced the news of vaccines coming to the territory last December, I've been patiently waiting to book mine. I hope that many of you share that same level of excitement as I do to receive my vaccine. Though we are tired, it's an exciting time to be a Yukoner. I can't wait to see my fellow Yukoners receiving their vaccines on that day. Our way out of this pandemic is by supporting Yukoners on our path forward and safely and effectively distributing the vaccine. Our responsibility as citizens of the world, of Canada, and of Yukon is to get ourselves vaccinated so that we can get out of this pandemic. Vaccine is our key, our salvation, our hope. However long it takes to end this pandemic with vaccine, it will take years longer without. As Minister Pillai highlighted, we've seen economic turmoil across the country. Facing a pandemic throughout this past year has taken its toll not only on our economy, but as well on our well-being. On the theme of recovery, we certainly know that the unintended economic impacts from the pandemic response have been significant, but we also know that these impacts go far beyond the economic. It's critical that as we talk about recovery, we focus on mental and spiritual recovery as well. Last year, my office worked with the Yukon government and the Canadian Index of Wellbeing team to conduct a first-of-its-kind Yukon Community Wellbeing Survey. The results are almost ready to be released, and I look forward to discussing them in detail at a future update alongside Premier Silver. For now, we have been doing some early analysis to help inform our overall approach to the pandemic response and to take stock of where we are and where the public is on an array of key social indicators of well-being. So here's a little bit of what we know. We know that more than 42% of respondents to the survey have experienced negative impacts to their mental health since the beginning of the pandemic. This number, of course, is not a huge surprise. The unpredictability and changes in our routines as a result of COVID-19 can create stress in every aspect of our lives, both professionally and personally. I think we can all agree how difficult this past year has been. It's been hard on everyone, and like most of you, I too am feeling the effects of COVID fatigue. When this pandemic began, I was hopeful that within a few months or a year, we would be throwing off the shackles of this disease. Clearly, we have had to learn to reset our expectations, even though the end is still in sight. The unpredictability of this pandemic has led us to live in a stressful and tense environment. When people experience this level of stress, our responses may range from anger to frustration to feelings of hopelessness and loneliness. Everyone reacts in different ways, and we likely all have experienced some emotional turbulence within these last months. While some have adjusted, others may be struggling as they grapple with the ongoing economic uncertainties and anxieties related to their business, work, and personal lives. When a viral infection of this magnitude strikes, it can cast a shadow of problems that may not be immediately visible. The emotional toll that the pandemic has taken on all of us is often overlooked. The imminent threat that the virus presents to our well-being, our physical well-being, means, in turn, our mental well-being might be neglected. In a strange time for all of us, there are also opportunities to be creative and to make sure that we're taking care of ourselves. Keeping routine is key. In my household, that's proven to be very important and helpful. Another thing for me has been finding ways to have even just half an hour every day for myself, typically like going for a walk or a quick ski whenever the weather and time permit. This personal time provides me with the opportunity to wind down before I go home to my family, so I can focus on family matters and household matters rather than just COVID. It's important that we find and engage in an activity that helps bring a sense of calm and relief from the ongoing stress of the pandemic. At times we all feel the need to escape or turn off the mind, and that's okay. But I would also encourage all of you to discover a meaningful and mindful way to center yourself, whether it be through going out on snowshoes, or listening to a true crime or historical podcast, or going for a quick walk around the block with your dog, or trying out a new recipe, whatever provides a small sense of relief. I've also found that looking at all the good being done in our communities can be extremely helpful. It can be easy to feel overwhelmed with all of the struggle and uncertainty in the world. Opening our eyes to the good and kindness in our own backyards can really change our perspectives, and not just local. Every day, amidst stories of suffering and angst and political turmoil, we also hear and are grateful for stories of connection, hope, and kindness around the world. We have made it this far. If we give up now, we will soon wish we hadn't. I wish I could tell you all that there was a concrete date and time that COVID-19 would be done, or at least not such a prominent focus in our lives. But I can't do that yet. This pandemic brings so much uncertainty that we cannot predict what changes we may be subject to over the upcoming months. We, of course, prepare to the best of our ability, but from time to time we are thrown a curveball that means plans and analysis have to be readjusted and timelines projected into an uncertain future. But here are a few things we can be certain about. This pandemic, too, shall pass. The end of this pandemic will come. The more of us that come forward for vaccine, the better off we will be, and the more we will be able to recover our freedom, our ability to gather, and our quest to normalize our lives once more. We have a rocky road of vaccine uptake and variant spread right now, but we will find ways to make life better while we wait to get there. If we can continue to keep COVID under control, keep variants to a minimum, and get vaccinated, then there will be opportunities to open up our lives. It is only the timing and the extent of these measures that we have to keep working on while we watch the variants carefully and continue the vaccination campaign. When we experience stress, we naturally want to escape it. This could lead to foregoing public health measures that are definitely not our normal way of life. If you find yourself having a moment of doubt, maybe even questioning why you need to follow public health measures, take a minute and do one small thing that puts things back into perspective. Think about how fortunate we are here compared to many places around the country or around the world. FaceTime a loved one, or research a future travel destination. Take a walk in the light and the snow, and remind yourself and each other that this is not our forever. We should admit and acknowledge that these are very difficult times we're going through, and it's okay if you're stressed and need to seek additional support. Please, if you are suffering, don't do so in silence. Before closing, I want to remind Yukoners of some of the available resources and counseling services in Yukon. There's the mental wellness and substance use services, and rapid access counseling for short-term counseling service is part of those services. You can book an appointment within 72 hours through 867-456-3838. And the Canadian Mental Health Association of Yukon counseling services are also available within 72 hours and free of charge. There's Let's Chat Yukon, which is a citizen-created service that promotes community connection, and they can be reached at 867-332-2772. Your family doctor or community nurse is also ready to help, and there are many skilled and dedicated private counselors and psychologists in our territory. If you are distressed, take that step and talk to someone. If it's someone you love or know, let them know that it's okay to seek help. That is a sign of strength. That's all for my update. Thank you. Remember to take care of each other and stay well. Merci, Cho. Thank you.
I'd like to thank you both. We'll move now to the phone lines and begin with Luke from CKRW.
Hi, I have a question for Minister Pillai. With these alternative self-isolation plans for plaster miners, will there be mandatory testing around this?
No, as of last year, this was the process that was put in place for a number of industries. So there's a process that happens between the industry members and folks from Dr. Hanley's team, where there's significant scrutiny put on the isolation plans to ensure the most efficient processes are in place to keep people safe and to get folks back to work. And once they've been endorsed, they then move to the Ministry of Community Services. So again, these are folks that will come in. They'll have 14 days isolation like anybody else would, but in some cases it might be in a different location than a hotel room or somebody's house if it was one of Yukoner coming back home to the Yukon.
Thank you. Next question, Luke.
That's the only question I have. Thank you.
Thank you. We'll move to Tim, Whitehorse Star.
Yes, thank you. Good morning. My question is for Minister Pillai. With all these measures that you were talking about in your comments earlier, kind of sounds like an election grab bag of goodies. Do we have a date yet?
I don't think it's an election grab bag of goodies because it's an extension of programs that were last year. So actually what it is giving certainty and comfort for the folks that are in the most vulnerable part of our economic sector that we are here to continue to support them. I think it also, as I stated, there was 345 people that used our sick leave program. I should note that we've had at least one other jurisdiction now just reach out to us that would like to potentially activate a program just like ours in a bigger province. So I think that validates the good work of folks who produce these programs very quickly, months and months ago, if not almost a year ago. So again, that's what it is. It's essentially supporting folks and letting them know that throughout this spring and this summer, they're going to be in a position where we're going to support them. Now, of course, we will be working very closely with Dr. Hanley's team and our own folks to look at what's going to happen to open things up as we move forward. But we want folks in the intern to know that we're going to continue to support them. And our business relief program, Tim, is probably one of the most boldest programs that's rolled out across this country. I've talked to many economic development ministers about what we have done, and many of them wish that they had been able to activate a program such as this, because it's been extremely effective in trying to hold folks steady until we see the economy opening up to its full potential.
Thank you. Next question, Tim? Tim, do you have a second question? We will move on and come back. We'll move now to Steve Silva, CBC. We appear to be having some problem with the phone lines right now. Tim, are you back with us? Okay. Steve, are you there? If you would just bear with us a moment, folks, we're going to see what's happening with our phone lines. Okay, one more time. Steve, are you with us?
Can you not hear me? Are you there?
No, we're here. Now we can hear you. We couldn't hear you for a while. Please go ahead with your question.
Going once?
Please go ahead.
Okay, can you hear me now, yeah?
Yes. I don't think you can hear me, though. Steve, if you can hear me, please ask your question.
Okay, well, I can hear you. So my question is, does the government have any numbers specific to the number of people eligible for the vaccine who are choosing to actually get it? Any percentages, any perhaps community-based numbers, anything like that? Or perhaps even how many long-term care workers received the vaccine if they were eligible? Anything like that?
Do you want to start?
Yeah, thanks. I don't have, so what we gave last week was the overall community uptake number, 53%. You will also notice, of course, the new graphic on the website, which gives a kind of a gauge of uptake. But we don't have as yet the numbers on, say, by sector, such as long-term care workers, and there's just some, there's been a lot of numbers flying around, and a lot of numbers that we've been analyzing right now. The main number that we're getting through is the numbers day by day who have first dose and second dose. So those are things that we will be analyzing as we kind of catch up with the initial rollout of the campaign.
Next question, Steve.
Okay, thanks. And then my other question would be for, I guess, Dr. Hanley and Minister Pillai as well, whoever can answer, I guess. In November, Premier Silver said that he was pushing for Yukon to join the federal government's COVID alert app. And so we're one of, I believe, 4 jurisdictions not part of that app right now, not able to register locals who may have COVID-19. And I know that concerns have been raised about recording relatively innocuous exposures, like someone walking by you at the grocery store, for example. But the app does say that an exposure is only recorded if you're within 2 meters of someone with COVID-19 for 15 minutes or longer. So I'm not sure how warranted that concern is. And with the Northwest Territories having been using it for months, there's a bit of a contrast. Like the Northwest Territories is using it, but we're not. So where is the Yukon government with that right now? And what exactly are the issues that are preventing Yukon from joining this app?
We'll start.
Yeah, it's a good question, and you're right that the COVID alert technical people have been making some adjustments and improvements to the app, and those improvements have been really trying to ensure or trying to really focus the contacts on those contacts that are more important for purposes of contact tracing rather than transient contacts. So it does make it more feasible. It is something that we continue to watch and engage in conversations with. I don't see this as a priority for us, and I think if you look across the country in terms of relative the add value, I guess, that is added to traditional contact tracing, I think that's the part that's fairly hard to tease out, especially, I think, when we're in our situation of having a containment approach, a small jurisdiction, and very good contact tracing capacity. So that's where it's really difficult to define precisely what the add value is. Now, I anticipate that it may have more add value as we open up more and as travel resumes and as people have contacts outside the territory. I think there's a potential role. So it's something that we're continuing to explore. As you note, there are significant other jurisdictions, including BC, who we work closely with, that has not signed up, as it were, to this app. So it's something we continue to monitor, but it's not a first priority right now. Of course, we're working in a number of other areas that are higher priority than this particular one, but it's something we are keeping an eye on.
We'll just go back. Tim, can you hear us?
Yes, I can.
Sorry, we lost contact with you for a little bit there. Would you like to ask your second question now?
No, I didn't have a second question. Thank you.
Okay, thank you. We'll move now to Haley at Yukon News.
Thank you. My first question, I'm wondering if there are some more details available on what went wrong with the booking system when it was first rolled out. I'm just wondering if the influx of people wasn't anticipated. What went wrong there?
I can try to. You know what, I think it would probably be best to have one of our team from our ICT team to be answering this question technically, but I think I would say, you know what, we're seeing this happen in a couple different jurisdictions. I think if anybody watched the news yesterday, you would have saw that Alberta also was going through it. So I think that the teams that build this digital infrastructure out, they know what they're doing, and we know there's a huge push. But I think again, there was just an overwhelming response, which we think is great. It's really the key foundation for us in the Yukon to keep moving forward. So again, I think they pivoted pretty quickly to get things working again, and we just want to thank Yukoners for their patience, as a lot of this is uncharted waters for folks, and they're moving very quickly under a tremendous amount of pressure to make sure that Yukoners stay safe and we have the right systems in place.
Dr. Hanley?
Also, what went right is that we are now booking for general population as of next week. The system is working. I think a new system with overwhelming demand, as Minister Pillai says. There's a lot of good news parts about that too. So yeah, definitely hiccups starting up. But we are in such a good position right now of being able to open up to the general public. You hear all around the country of where others are, and I think we just need to keep that in mind and keep stepping forward as booking slots become available to get our as close to our entire adult population immunized as we can.
Thank you. Next question, Haley?
Yes, thank you. My other question had to do with opening up the bubble with Northwest Territories. I've seen some discussion about that in the news. I was hoping for Yukon's perspective on opening the bubble with the Northwest Territories.
Yeah, I think Dr. Hanley and I had a chance to have a quick conversation today. I think for folks that saw some of the coverage on it, it was the Chief Medical Officer in Northwest Territories and our Chief Medical Officer would have a discussion. And I think, I'll hand it to Dr. Hanley, I think, to update you on how that conversation went. So.
Yeah, it's definitely something that we've been keeping in touch over. We love our neighbors and the other northern territories and remain in weekly contact with them. And I think it's it's one of those moving conversations as we continue to vaccinate our population, and we'll be continuing to discuss those possibilities. Again, it really is I would encourage a premier conversation around this, and then we would look at the public health aspects and make our recommendations accordingly.
Thank you. We'll move. Oh, sorry, go ahead.
To just add, we do understand as well the significance for both our economy here, as we are a critical point of the supply chain on the Dempster Highway into the North Slope and Northwest Territories, and we also understand that there's businesses that are along that route that have been highly impacted by what has happened, and so we do know that as soon as it's as safe as possible to get that in place, that's the work that our teams will do together.
Thank you. We'll move now to Mario, Radio-Canada.
Yeah, hi. My question is for Minister Pillai. I'm not too familiar with it. I'm just trying to understand what that regional relief loan program is. This something new, or is this one of the things that was extended today?
No, the relief, the regional relief program is something that's new. Some jurisdictions have launched it in concert with support from the federal government. It's something that we think is another tool in the toolbox that can be used. As you heard, the terms that I've spoken about are quite quite conducive to somebody that's under pressure at this particular time to be using this tool, in the sense that there's a forgiveness of up to 25% of the principal amount. But let me say that we are aware that folks have as well have been under a lot of pressure in areas of the economy. They're really not. Their first choice, of course, is not to incur more debt. So that's something, of course, that's why our programs have been structured in a different way to not put that extra pressure on. But in some cases, there's businesses that I think that this could be a valuable tool. It's it gives folks some help with supporting their business with cash flow and other. And if that can fit into the model that they're using, in the end, they're in a position where in some of these loans, they'll have up to $25,000, which really becomes in a grant form if they pay it back early. So it's just another item that we've launched, and we think it could be helpful to some areas of our economy.
Thank you. Do you have another question, Mario?
I do not. Thank you very much.
Thank you very much. I'd like to thank everyone for their time today. Next week, the COVID-19 update moves to a new day and time. The next update will take place on Wednesday, March 3rd at 10:30. Again, Wednesday, March 3rd at 10:30 a.m.